Two-minute anaesthesia, pituitary gland. The pituitary gland, or hypophysis, is a master regulating gland. It's located in the base of the skull, the sella turcica. It has a range of functions including metabolism, sexual function, reproduction, immune, breastfeeding and growth. It weighs just under 1 gram and has two lobes, anterior and posterior. It's regulated by the hypothalamus. The pituitary is composed of a stalk or infundibulum and the anterior and posterior components of the gland. The anterior component, known as the adenohypophysis, has three parts: the pars distalis, which is a major hormone production site, the pars tuberalis and pars intermedia. The posterior component, also known as a neurohypophysis. There's a range of key components around the gland. Superiorly, there's a second cranial nerve, the optic nerve. Laterally, there's the cavernous sinus, which contains the internal carotid artery, cranial nerves 3 to 6. And inferiorly, there's a sphenoid bone, which contains the sella turcica, which is a saddle-shaped depression within the bone. And also, within the sphenoid bone, there's a sphenoid sinus. So as we've previously discussed, there's the anterior and posterior components of the gland. The anterior is adenohypophysis, posterior is a neurohypophysis. The anterior component is embryologically from the pharynx, and this relies on the hypothalamus secreting specific factors which move down the portal system to activate the release of anterior pituitary hormones. In comparison, the posterior pituitary is an extension of the hypothalamus. Within the hypothalamus, there's two key nuclei, the supraoptic and the paraventricular, which produce hormones. These hormones travel down vesicles and they're stored within the posterior pituitary before they're released. The internal carotid artery has two key branches to supply the pituitary: the superior and inferior hypophyseal arteries. The SHA, or superior hypophyseal artery, supplies the infundibulum of the gland, and through the portal system, i.e. two capillary beds, supplies the anterior component of the pituitary. The posterior component is supplied by the inferior hypophyseal artery. Conversely, the venous supply is from the hypophyseal veins, cavernous sinus, the petrosal sinus, and then into the jugular vein. Pituitary hormones include the anterior, the 6, TSH, LH, FSH, ACTH, prolactin and growth hormone, and the posterior part of the gland is 2, ADH and oxytocin. This slide covers anterior pituitary hormones. The top line are stimulatory hypothalamic factors, the middle line are the pituitary hormones, and the bottom line are the target organs. The inhibitory factors are shown in red. So for growth hormone, it's growth hormone inhibiting hormone, or GHIH, also known as somatostatin. And for prolactin, it's dopamine. So for example, you have TRH, thyroid releasing hormone, which results in release of thyroid stimulating hormone, and within the thyroid gland you get release of T3 and T4. For the posterior pituitary, it's a little bit different. As we previously discussed, ADH and oxytocin are produced in specific nuclei in the hypothalamus, which travel down axons and are stored in the posterior pituitary. Upon activation by osmoreceptors for ADH, fetal descent and breast augmentation for oxytocin, these hormones are released. ADH has effects on the distal convoluted tubule and the collecting duct in the kidney, which increases through G protein coupled receptors, transcription and insertion of aquaporin 2, allowing increased water absorption in the kidney. Conversely, oxytocin release results in GQ coupled G protein coupled receptor activation, leading to calcium influx, which facilitates uterine smooth muscle contraction.